Hello, Dr. DNF here from Steinway Family Dental Center. Well, we get a lot of questions about dental decay. So today we're going to answer some of the most common questions about dental decay. Let's see what we got. The first question is, so what is tooth decay? Well, the decay is basically a soft tooth. Teeth are naturally hard, right? So when they start getting soft in this particular spot and they decaying, you can tell by them getting like little brown spots or black spots on them, and they become soft, like you can push on it and you can feel that it's moving in. Sometimes you can see right under the enamel, like a little dark halo, right? So you know you're getting a cavity. But the best way to find out if you have decay or not is, of course, to see your dentist. Next question we got is, what causes dental decay? Usually it is because the food is getting not removed from the particular area on time, and that the food will oxidize and will become more acidic, like kind of like when you have garbage sitting outside, right? It's getting a little smelly and it's oxidizing. So the same thing become more acidic is the food that getting stuck in between the teeth, for example, and it's sitting there and becomes more acidic and making the enamel surface weaker. And because of that, the enamel will crumble over time and you would get decay. The next question we got, what are the signs of tooth decay? So the signs could be that you become sensitive to temperature, especially cold. Like if it's the beginning of the decay, you may not feel anything. So the temperature would not be a factor and you may just see something wrong. A lot of times we're not looking hard enough at that, so we may miss it. And the next time we feel it, we're sensitive to either temperature, like cold or hot, or we may be sensitive to sweet. And those are possibly the signs of decay. So we recommend that you get your checkup regularly so you can catch it early. The next question we got, what is the effect of tooth decay? Well, the tooth decay will basically destroy the tooth structure, right? When the tooth is decaying, the structure is not solid anymore, and you can bite into something relatively not even hard and break the tooth. It's also decay can reach the nerve and then will become very, very painful. So if you suspect that you have decay, then you're welcome to call us and we'll find out whether you do or you don't. The next question is, can tooth decay lead to other complications? Well, it can lead to tooth loss, right? If the tooth is cracked in half and now we can't save it anymore, so that's not a good thing, and it led by tooth decay. Or it could be that you would have a lot of pain, you can't sleep at night because the decay is so deep. But it also could be that it just doesn't look right. If it's in your front teeth and you smile and you can see that there is decay in the teeth, I doubt it's a date maker, right? The next question is, can tooth decay return to normal? Well, the answer is the only time that the tooth decay returns to normal is when the dentist treats it. All these other remedies that so-called remedies you heard, they may slow it down a little bit, but if decay is developed fully, there's no fixing it unless the dentist will fix it. The next question is, at what point the tooth decay is irreversible? Well, if the decay goes through the enamel completely, the enamel is the white part that we see on the teeth, right? It has a certain thickness. So if it just went through half of it, there's still a possibility by using specific methods, like using, for example, MI paste, like MI, right? You can use that MI paste, and that will help you to remineralize the enamel and fix it. But if it went through the entire enamel, it's too late for that. And the only thing that can fix it is the dentist. The next question is, what are some treatments for tooth decay? Well, if the decay is small, you can get the decay cleaned out and then restore the tooth, like put it back to normal size with the special materials like fillings, right? There's also materials called inlays or onlays. They are laboratory made, and they're made out of solid material, and then they get cemented into the area that is missing on the tooth. But of course, first the decay has to be removed. There are times when it is too late for all of that, and then you would need a crown. Hopefully, you're not letting it go as far as you losing the tooth completely. The next question is, how do I stop tooth decay from spreading? Well, the first thing is see your dentist. That is the only way that's going to stop your decay from spreading. And when dentists tell you that this is what we can do to save your teeth, do it. Do not wait. The faster you start on it, the faster you're going to finish and the smaller the damage is going to be. Next question is tooth decay painful? Sometimes it's not, unless it's already reaching your nerve. So if it reaches your nerve, then yes, it is painful. But when it is small and it's not in the nerve yet, you might be slightly sensitive, but maybe you don't even feel it at all. And by going to the dentist, you can catch it when it's really small and you can fix it faster. The next question is, when should I see the dentist for treating tooth decay? Well, you should go to your dentist regularly so they can catch it when the decay is really small, and you can go every 6 months to have it checked. That is all the questions we have for the tooth decay questions. And if you would like to know more, you can always schedule an appointment with us here at 718-728-3314, or you can go online on alldentalneeds.com and request an appointment, and we can do the checkup on you, see what decay you have on that, and answer all your questions about your tooth decay.